What if I told you some of the most powerful IV antibiotics in the world are being turned into inhaled lifesavers? Right here, behind this hood. Today, I'm taking you behind the scenes into the world of clinical compounding, where pharmacists transform Colistin, Gentamicin, and Amikacin into weapons against drug-resistant lung infections like cystic fibrosis, ventilator-associated pneumonia, and non-tuberculous mycobacteria. We'll break down the exact aseptic techniques, dosing strategies, and safety steps we follow to make sure every drop of medicine hits the lungs, and not the bloodstream. Whether you're a pharmacy student, a clinician, or just love science, this is one video you don't want to miss. Let's step into the hood and see the magic happen. Let's take a moment to zoom out and ask the big question. Why does this even matter? Why go through the effort of turning IV antibiotics into inhaled therapy? Because when it comes to fighting multidrug-resistant lung infections, like Pseudomonas aeruginosa, Acinetobacter baumannii, or non-tuberculous mycobacteria, time, precision, and potency matter more than ever. These aren't just rare conditions. They affect real people every day. Patients with cystic fibrosis, those battling ventilator-associated pneumonia, and adults living with chronic bronchiectasis not linked to cystic fibrosis. That means 1. Higher local concentrations right at the infection site. 2. Fewer systemic side effects like kidney or hearing damage. And 3. Faster symptom relief in many cases. It's a smarter, more targeted approach, and one that's saving lives, preserving lungs, and reducing hospital stays. This is why clinical pharmacists are stepping up to compound with care, precision, and purpose. But none of this works without mastering one essential skill first: sterile technique. Let's step inside the hood. Before you ever draw up a single drop of Colistin, Gentamicin, or Amikacin, you need to master one non-negotiable rule of respiratory compounding: aseptic technique is king. When you're compounding drugs to go directly into a patient's lungs, there is zero margin for error. The lungs are sterile. Your product must be too. It all starts here, inside an ISO Class 5 laminar airflow hood. That means the air is filtered and replaced constantly to remove even the tiniest particles, bacteria, or fungi. Next, full PPE, gloves, gown, mask, no shortcuts. Your job is to protect the product, not the other way around. Use only preservative-free vials and diluents. Preservatives like benzyl alcohol or parabens. Absolutely off limits. They can damage delicate lung tissue. And don't forget this final step: label everything. Each syringe, each neb cup, each vial must read, for inhalation use only. Not for IV. Every move matters. Every step counts. Because this isn't just about making medicine, it's about making it safe enough to be inhaled directly into human lungs. Now that you're ready to compound like a pro, let's start with the first inhaled warrior on our list: Colistin, the comeback antibiotic. Now let's talk about one of the biggest comeback stories in antibiotic history. Colistin, once shelved for toxicity concerns, now reborn as a last resort lifesaver in the age of multidrug-resistant superbugs. Its modern form, Colistimethate sodium, or CMS, a prodrug that gets converted into active colistin right inside the body, or in this case, right inside the lungs. Most vials contain 1 million international units. That's roughly 80 milligrams of colistin base activity, or CBA. But to deliver it via nebulizer, we need to rework it. Here's how you compound it step by step. 1. Reconstitute the vial with 2 ml of sterile water or 0.9% sodium chloride. 2. That gives you a concentration of 66.7 mg of colistin base activity per milliliter. Now draw up your prescribed dose. Typically 75 to 150 mg of colistin base activity, based on the patient's condition, weight, and respiratory function. Then dilute the dose with normal saline to make a total of 3 to 5 milliliters. That's your final nebulization volume. Because colistimethate sodium is chemically unstable, it should be used immediately, or refrigerated and used within 24 hours. And never freeze it. And here's a critical warning: don't mix colistin with other nebulized medications in the same cup. Incompatibilities can destroy the drug's potency, or worse, harm the lungs. Colistin may be old, but it's more relevant than ever. When compounded correctly, it delivers targeted, high-concentration therapy directly to the lungs, bypassing the bloodstream and sparing the kidneys. Up next, a no-fuss, highly effective aminoglycoside you'll definitely recognize: gentamicin. Let's keep going. Next on our list is an antibiotic that's been a workhorse in hospitals for decades: gentamicin. It's reliable, potent, and surprisingly straightforward when it comes to inhaled compounding. We use the injectable form of gentamicin, typically at a concentration of 40 mg per milliliter. But there's one major rule you can't ignore. It must be preservative-free. That means no benzyl alcohol, no parabens, because those additives are toxic to the lungs when inhaled. Here's how to compound it safely. 1. Draw up the prescribed dose, usually 40 to 80 mg. 2. Always use a filter needle when pulling from a glass ampoule to avoid tiny shards that could end up in the lungs. Then, dilute the dose with 0.9% sodium chloride to a total volume of 3 to 5 milliliters, perfect for nebulization. But here's where it gets clinical. Gentamicin can cause bronchospasm in some patients, especially those with reactive airway diseases like asthma or cystic fibrosis. So always monitor respiratory response, and consider pre-treating with a bronchodilator like albuterol if needed. Use the compounded solution immediately after preparation, or refrigerate and use within 24 hours. Never reuse beyond that window. Gentamicin's beauty lies in its simplicity. A trusted antibiotic, delivered straight to the site of infection, with minimal systemic exposure and maximum local impact. But when the infection is more complex, more resistant, or more stubborn, that's when we reach for the heavy artillery. Up next, amikacin, the inhaled big gun. When standard antibiotics just aren't enough, and the infection is laughing in the face of resistance, we reach for the big gun. Amikacin. Amikacin is an aminoglycoside known for its broad-spectrum punch, and when compounded for inhalation, it becomes a critical tool in managing some of the toughest lung infections we see today. It's most often prescribed for Mycobacterium avium complex, or MAC, a chronic lung infection that affects immunocompromised and non-cystic fibrosis bronchiectasis patients alike. It's also used in difficult cases of Pseudomonas aeruginosa, multidrug-resistant gram-negatives, and non-tuberculous mycobacteria infections that fail first-line therapy. Here's how you compound it safely and effectively. 1. Draw your prescribed dose, usually between 250 to 500 milligrams, from a vial labeled 250 milligrams per milliliter or 500 milligrams in 2 milliliters. 2. Next, Dilute that dose with 0.9% sodium chloride, bringing the final nebulizer volume to 3 to 5 milliliters. This ensures smooth aerosolization and effective lung delivery. But don't rush this step. Check the vial very carefully. Avoid any preparation containing preservatives like benzyl alcohol or parabens. These additives can cause severe lung toxicity, especially with repeated inhalation. Once prepared, the solution should be used immediately, or refrigerated and used within 24 hours. Beyond that, you risk degradation and loss of potency. When used correctly, inhaled amikacin delivers powerful, localized therapy with lower systemic absorption than IV administration, reducing toxicity risks while targeting infection where it matters most. It's a heavy hitter, no doubt, but one that demands respect, precision, and clean technique. So now that we've covered all three, Colistin, Gentamicin, and Amikacin, let's pull it all together with a final comparison and best practice recap. Let's pull it all together with a quick comparison of the three most common inhaled antibiotics compounded in hospital and clinical pharmacy settings. First up, Colistin. The typical dose is 75 to 150 milligrams of colistin base activity. Diluent, always 0.9% sodium chloride. Final nebulizer volume, 3 to 5 milliliters. Key point, you'll need to reconstitute a 1 million international unit vial, then calculate the correct amount of colistin base activity. Precision is everything. Next, gentamicin, most often prescribed in the 40 to 80 milligram range, also diluted in 0.9% sodium chloride to a final volume of 3 to 5 milliliters. Always use a filter needle when drawing from ampoules, and don't forget, monitor for bronchospasm. Pre-treat with a bronchodilator if needed. And finally, amikacin, the heavy hitter. Dose range, typically 250 to 500 milligrams, diluted again in normal saline to 3 to 5 milliliters for nebulization. Here's the big one. Make sure you're using a preservative-free vial. Even trace amounts of benzyl alcohol or parabens can cause serious pulmonary toxicity. While each of these antibiotics has its own strengths, they share some key best practices. Number 1. Always compound under sterile conditions. Number 2. Label clearly. For inhalation use only. And, number 3. And when in doubt, consult your infectious disease team. As we close out this compounding journey, let's lock in the most important takeaways. The practices that don't just guide technique, they protect lives. First and foremost, aseptic compounding saves lives. Inhaled antibiotics bypass the gut, skip the bloodstream, and go straight to the lungs, which means sterility is everything. Every dose must be clean, pure, and professionally prepared. Second, always use preservative-free vials and diluents. Preservatives like benzyl alcohol and parabens may be harmless in IVs or intramusculars, but when inhaled, they can cause serious lung damage. Double-check every label, every time. Third, prepare doses as close to administration time as possible. These drugs aren't stable forever. Many break down within 24 hours. Freshly compounded equals maximum potency and patient safety. And last, but just as critical, educate your patients. Teach proper nebulizer technique, cleaning protocols, and how to recognize signs of bronchospasm or contamination. A great compounder isn't just sterile. They're also a great communicator. Whether you're a hospital pharmacist, a clinical student, or a sterile compounding tech, your attention to detail makes a difference. When you compound correctly, you're not just filling syringes. You're filling lungs with hope and healing. You've mastered the basics. Now let's elevate your game with a few pro tips that separate good compounders from great ones. Tip number 1. Always double-check drug concentrations, especially with Colistin, where labels show international units, IU, instead of milligrams. Confusing international units with milligrams can lead to massive dosing errors. Don't guess. Know your conversions. Tip number 2. Document everything. Record the exact dose, the type of diluent, and the final volume. That's not just good practice. That's clinical accountability. Tip number 3. Label boldly. Every neb cup, syringe, and vial should scream, for inhalation use only, not for IV. One mislabeled dose could be catastrophic. Tip number 4. Watch for incompatibilities. Never mix inhaled antibiotics with other nebulized drugs unless they've been explicitly proven compatible. Some drugs will precipitate, degrade, or lose potency when combined. Tip number 5. Teach your patients technique. Nebulized antibiotics work best when inhaled deep into the lungs, not just misted into the face. That means mouthpiece only, not a mask. Always demo it yourself if you can. Small actions, big outcomes. Your precision at the hood, and your presence at the bedside, could mean fewer exacerbations, shorter hospital stays, and longer breaths of life. Want more real-world clinical tips? Hit like, share with your pharmacy team, and drop your own pro tip in the comments below. And there you have it. The essential guide to safely compounding inhaled antibiotics, Colistin, Gentamicin, and Amikacin. These drugs may be powerful, but your technique is what makes them life-saving. If this video helped boost your clinical confidence or gave you a fresh perspective on respiratory compounding, go ahead and hit that like button. Drop a comment below and tell us, what's your favorite inhaled antibiotic technique? Share this with your pharmacy crew, and subscribe, because we've got more compounding tutorials coming soon. From sterile technique to dosing deep dives, this channel is your go-to spot for turning clinical knowledge into daily practice. Let's make sterile technique viral, for the right reasons. Thanks for watching. Stay safe, stay sharp, and keep compounding clean. I will see you in the next one.